Welcome back, everybody. It's time again for the one show that shows you how to live a healthier life. It's Health Talks with Dr. Trin, the healthiest guy I know. Just look at his workout regimen this morning here. Dr. Trin, how are you, sir?
Hey, I'm good. Good morning.
I made the mistake of saying you look like you just got out of bed, and you said, no, I just came from the gym. So suddenly I felt shamed because I didn't come from the gym here. I just woke up and got out of bed here.
Yeah, yeah. We want to talk a little bit about the fact that we're moving to a new tier.
What? Yeah, this is the topic. We had a guest that had to cancel at the last minute. We'll have her come in again here. The singing ICU nurse who's getting headlines up in Canada for her positive work and outlook. But
Yeah,
I thought it's a perfect time. We have waited a year for this moment, and yellow tier may lead to all clear in a month or two. That's the projection. The curve seems to be headed in that. Take your masks off. Happy days are here at last. What does yellow tier look like?
yeah. And what are the latest CDC recommendation on masking?
Yes, exactly. We're going to talk about that. We'll talk about what is yellow tier and the. Of course, I'm a pessimist at heart here. So, are we getting ahead of ourselves? Are we going to be right back where we were at the end of summer, early fall? We're going to roll back again like they are in India and Michigan and other places around the country, or are we just headed towards the sunshine here? So let's
Yeah,
start with what does yellow tier look like? What is yellow tier?
yellow tier. I don't think looks much different than orange tier
Hmm.
that we were in.
But
I
it's the
believe.
it's the last tier before no tier, right?
Yes, it's the last tier before complete freedom. Did you see the news that was like that made it made national news
Hmm.
on the OC supervisors meeting the other day?
I did not. I did not. Tell
It
me about it.
it made national news. There were
Not in
I
a
guess
good,
there were
not in a good way, I assume, right?
yeah, there were hundreds of folks who were lined up.
Oh, I did hear about. I didn't know it made national news, but I did hear about talk about that. And Supervisor Doe kept shutting them off as he didn't want to literally shutting their mics off.
Well, it's because so many people wanted to speak, and
Yeah,
we only had a few hours,
right.
right? That was available
But the
for
perception was, because there's all these people want to speak, and rather than let them ramble on, it was like, okay, you said your 2 minutes.
30
Go.
seconds per person.
30
It was
seconds per person. Yeah, wow.
because there was like 500 people lined up to speak, and
Wow.
and to accommodate that, it was like 30 seconds per person to try to accommodate the hundreds of folks who wanted to specifically speak at this specific OC,
So
supervisor.
what was it that drove 500 people to drive out to a sleepy Orange County supervisors meeting here?
Vac- the fear of vaccine passports.
Yeah, I don't.
People, folks don't want it, and well, the vaccine passport isn't even on the agenda actually,
No.
but they were being proactive apparently.
Yeah, they were getting ahead of it and say, "Don't you even think about this." Well,
Don't
and
even think about
and
it,
you know
right?
why they did? Because at the last show, I got off on my little tangent about vaccine passports and how I support them, and or wouldn't oppose them. Let's put it that way. And
Right.
everybody on the thing was rolling their eyes at me, saying, "Okay, Paul, time to wrap up this one here. You're getting on your rant here." Uh, but let's talk about all of that this morning. This is kind of an open forum. This is a COVID update
Yeah.
for those on Facebook here. I'd like to hear. Let's start with before we get there. Before we ask everybody, let's do two things. Here's my
Yeah.
thoughts. One, let's ask everybody joining us this morning: COVID passports. Good idea,
Or bad idea.
bad idea. Support it, hate it. So let's just get our own little survey. And while we're getting that, people logging on and telling us, why don't you tell us what does yellow mean? This is the last stage before they take away. And I'll add one more thought to that. I even read so much as to say that Governor Newsom is proposing getting rid of the tier system by June. That would be next month.
Ooh, so what he's proposing is because of the good numbers we are seeing
Yeah, we may
here
get
in
rid of
California.
all the tiers and just go back to
Go back to
wide
normal
open.
life,
Yeah,
right?
right.
Go back to normal life.
So yellow is what? Yellow now allows more open. It's
A
not that
high
different.
percentage of capacity.
Yeah,
So if orange tier means a certain percentage, if you got a restaurant, you can't fill it up to 100% capacity.
right.
You're limited by a certain percentage capacity. If you have a store, if you're at Costco, if you're at a retailer, you're limited to a certain percentage of your capacity.
And
So
and now the capacity grows. It goes from I think
now the capacity
25 to
grows.
35 in some categories, or maybe
Exactly,
50 or
exactly.
something. Yeah.
So the capacity grows is what we're seeing, and so yeah, that's essentially what it is. It's just improving the capacity. I think bars, it doesn't tell you can drink more alcohol, but maybe it improved the capacity of those who can enter a bar.
I
So
don't know how bars and restaurants. I was in the bar business 20 years ago. I had a kind of a legend. I was a partner in like kind of a legendary bar called Kelly McHugh's in South Orange County. It was around for like 10 years, and I can't imagine. One, we lived on such short margins. As many people as we had there, most bars and restaurants only exist on about a 5% profit margin. So
right,
you take away 50% of your customers or 100% for a while. I don't know how any of these places survived, and I can't believe the landlords just don't pay us the rent for a while. They may have delayed it, but you still got to pay the rent. You still got to pay the utilities. You can fire all your employees or furlough them, but you still got a lot of fixed costs that I can't imagine how these bars and restaurants survived. I really can't.
right, exactly. And so basically going from orange to yellow means we increase capacity. So what it means is we're allowing bars that don't serve food, to operate now indoors as
Right.
opposed to outdoors.
Yes, that was. I think
With,
if you had a bar and you didn't serve food, which there aren't many of those, most bars have
yes.
gotten smart and serve food for a variety of reasons. More profit,
Hmm.
slows down the amount of alcohol you consume because you start filling up. You're not just in there pounding drinks down. For
Right.
all those reasons, I can't think of a bar that just serves booze. There used to be bars like that, but most of them have moved in. Most of them have a different life. And also, if you just serve booze, then you can't let anybody under 21 in the place, and most of them want to have a capacity to. So it's like Red Robin. Mom and dad can have a cocktail, and Junior can have a burger. So usually they don't want to go there. So I can't believe there's many of those,
Hmm.
but
Right.
I think that it's a good move. Now here's the question I have. While we're still waiting for people to log on and answer our question this morning is COVID passports, are they coming or are we going to fight them? Good idea, which we welcome, or bad idea, which we're going to fight tooth and nail? While people are answering that, I want to ask you the question, why? Why is Orange County and California in general moving so rapidly in the right direction when so many others in the world, Europe, perhaps, certainly India and Brazil,
Yeah.
other parts of the country, rapidly moving back into a problem again? Why are we doing good and they're going back?
Because we have vaccines.
Is that it? It's really that simple?
Because we have vaccines. If you're looking at countries that are doing well,
Uh huh.
these are countries that have vaccinated their people at a really high number. For example, Israel.
Uh huh. Yeah, Israel's supposed to be one of the
Israel
best, right?
is one of the best, and their COVID rate is under 1%.
Wow.
Right? If you're Even England is looking really good because
Yeah,
again
England that had
have
such terrible
vaccine.
trouble, right?
They had trouble, and so when we talk about disparities, right? The countries that have the vaccine and they're vaccinating are the countries that we are seeing drastic drops in their COVID numbers with hospitalizations, with deaths, and with new cases, compared to like India, who everyone's read about India and the horrible, pandemic that's going on there with COVID.
It's almost like back to record numbers again here. They're running out of supplies. They're running out of oxygen. People are dying again in bigger numbers, and we're like, why? This has been a year. Didn't we learn anything? Didn't we do anything?
Yeah, it's and so yeah, lack of vaccines is the issue. And it's funny because there are folks here in the country who don't want vaccines, obviously.
Yeah.
Vaccine hesitancy is about 1 out of 4. 1 out of 4 Americans are
Unbelievable.
hesitant to get the shot, don't want the shot, fear of the vaccine and what, side effects and things of that sort. And there are people around the world who would love to get the vaccine just because they're dying, they're
Right.
being hospitalized.
All right. Well, we've got some comments coming in from especially some of our longtime listeners and join us here. Dan Daly, thanks for piping in. Robert, is it Lanez? Sorry if I'm mispronouncing your name. But we've had so far, it's 100% against. It says
Against vaccine passport.
against
Yeah, and
vaccine passports.
you
Yeah.
know what it boils down to? Okay, there's two different things that should be addressed. The first is digital documentation
Mm.
that you've been vaccinated,
Hmm.
right? Which is not a passport. It's digital documentation.
It's
say,
on your phone or something,
on your
someplace you
phone,
can go.
right? On
Right.
your phone, on the Othina app, right? That's trying to get everyone standardized. Digital documentation that you've been vaccinated.
Right.
The second issue, though, is passports. Using these digital documentation as a passport
Hmm.
to allow you to do certain things or not certain things.
Get on an airplane,
to allow
go to
you
a
to enter a
restaurant.
restaurant.
Right. Yeah.
Get on a cruise, get on an airplane. So the issue really is trust in the government. What is our government going to do? What is Newsom going to do? Right? What is the federal government going to do
Hmm.
after everyone has access to this digital documentation
Right.
that you've been vaccinated? Is it going to be Big Brother? Can you not go to eat at a restaurant now, or enter, a gym, or go to a business if you are not vaccinated? Does that lead to mandatory vaccinations, especially for the 1 out of 4 Americans who are hesitant
Right.
for many reasons, and I don't blame them. I'm not going to shame anyone to be vaccinated or not be vaccinated. I think we all just weigh the risks versus the benefit of vaccination. What I am concerned about is all the misinformation about vaccinations that's out there.
Clearly, and our last show was all about that. The masked warriors, where we were talking about, and you guys were all pretty positive. I was trying to be kind of the bomb thrower in the room, and saying, at some point, do we have to just force people to go along with the program? Because we don't, the bug keeps percolating. It keeps changing. There's an open. It's an open petri dish that this bug can keep morphing and doing it. Whereas if we force everybody to do this, whether they like it or not, then we can exterminate this thing. So let me give you the other side of it. I'm not going to. I'll try to be calm today here. Restaurants. When I was in the restaurant business, in the bar business, we were forced to stop indoor cigarette smoking. Everybody thought that was a doom and gloom, overreach by government. You can't tell me what to do. Even though it was a minority of people, the majority of people don't smoke, just like the majority of people will get vaccinated. We had to respect that certain number of people, a significant number of people, probably 25% of the public of our population or our customers wanted to smoke. And we were afraid that if we did that, our business would crash and burn. There'd be protests. People would fight. It would be ugly. It was the opposite. It went through so smoothly, and the majority of people instantly said, thank you for getting rid of the smoke. Hallelujah. We've been suffering because of the smoke. We'd much rather go. And the handful of people that really wanted it, we accommodated them by giving them some outdoor dining. An outdoor area where they could still go out and, puff away.
Right.
But And there were a handful that protested and yelled and said, "You'll out of my dead hand, you'll never take my cigarette." But I was shocked how quickly the public rallied and said, "I like this idea." I can't believe that most people wouldn't like to feel, I would, that I was safe in a crowd again.
Mm. So, because and you're safe in the crowd because the crowd has been documented to all been vaccinated.
Exactly. So I feel comfortable on this flight
Yeah.
or at this resort or in this bar because I know everybody in here has gone along with it. So I don't know. I know everybody thinks of it as a government issue. I wonder if it's a public issue. So we're afraid of the reaction of some who will say you can't force me to do something.
Right.
But would the crowd? Let's say it was a voluntary thing. Let's say one restaurant next door said, it's my business. I can do what I want. And
Right.
for the safety of my employees, safety of my customers, safety of me, I'm going to
Right.
I'm going to limit it. You got to show me that you've been vaccinated. You can't, the government's not forcing me to do it. I'm going to force everybody. It's my business. If you want to come in, I do this. It's the same philosophy as no shirt, no
Yeah.
shoes, no service.
That's true.
What,
That's true because individual businesses can mandate it.
right,
It's the government can't mandate it, but if it's like individual businesses will say you have to wear a mask if you want to go shop here.
right.
So
And look how quickly that happened. There was an outcry when Target and others said you can't come in without a mask, and people said, and there were well documented cases of people screaming and yelling and saying you can't make me, and this is America. And they went, it's a business, it's our business, and we have decided that for everybody's safety, including our employees, including our customers, and including us, because we don't want to get sued. That's always the big fear. We don't want to say we let you in and you got sick here. So for our safety and our security and our lawyers, we're going to tell everybody to wear a mask. And how quickly everybody went along with it. I remember going to a Target early on in South Orange County. Probably half of the people weren't. And now I go to a Target a week ago, 99, if not 100% of everybody's got a mask on. We accepted it. We rolled over.
You know what's interesting? A year ago, we couldn't find a mask anywhere.
Yeah. Well,
Yeah, and now the masks are so cheap, they're trying to get rid of it because of excess inventory.
So again, I'd like to hear from the couple of gentlemen that piped in or anybody else. Everybody's afraid. Dan Daly said it all. Bad idea. It will be misused. So government mandates are feared. Yet we have a government mandate. I'll just push back once and then I'll give up. We have government mandates that you can't smoke in a building. We have government mandates that you have to wear a motorcycle helmet, whether you want to or not, because the danger for the rest of us is too great. We have mandates that you have to have insurance to drive a car. Bit by bit, Big Brother has crept in and forced us to do what some don't want to do. And we accept it because the majority of us feel better knowing everybody's got car insurance. The majority of us feel better knowing nobody's going to smoke in the bar. And the majority of us might feel better if we knew everybody had been vaccinated. That's my argument.
Nice. Dan, what do you think of that? Barbara, Robert, what do you guys think of that?
And again, I'm not trying to push my point of view. That's my point of view, but I'm very honestly curious how people feel it would be misused or how it would open the door to something darker, deeper.
Howard says just because we have mandates doesn't mean they are correct.
Oh, no, I completely agree. That's why we're saying it, that all of these may be overreach. Well, I think there's a certain segment of the population that hates the nanny state, as they call it. We're going to make you do this for your own good, whether you want to or not.
Yeah. So, yeah, I mean, it's hard to the argument is 1 out of 4 Americans do not want this shot,
right?
And if you're going to create a passport, you're going essentially we are shaming the 1 out of 4 folks economically and affecting their lives.
We are penalizing them, or we're trying to pressure them to conform, right?
Yes, yes, and
So
his
I
dad.
don't think you can force every. Here's my feeling. Where mandates stop for me, the government can't go door to door and drag you out and stick a needle in your arm. But they can say, okay, if you want to do that, great. If you want to go smoke a cigarette, you can smoke it wherever you feel like. We haven't banned cigarettes, even though there's lots of reasons to do that.
Yeah.
We still let people make those bad choices. But if you're going to make those bad choices, you can't do them in a group and make everybody else sick.
Mm-hmm. Yep. Yep. Howard says tyranny, uh,
Of the
if the
majority is.
majority is still tyranny. Yes. Time for local elective officials to push back against burdensome state government. Dan says majority of people wouldn't use good judgment. You can't force it.
So, and last thought, I'll just throw this out,
Yeah.
and then we'll get off this topic because it's clear your audience is overwhelming. I'm in the minority on this one here. Um,
Uh,
I suspect even Dr. Trin's against it here. You haven't weighed in, but I get the feeling every time I say this, you get kind of uncomfortable. Passports. What about this?
yeah.
So, no passport,
Right.
and 25% don't do it, and the bug continues to breed, and it turns into a more virulent strain that my vaccine does not cover. Now I got to go get vaccinated again, or I can get sick again because this bug is now a new variant that was not handled. Will I be angry at those 25% of people who allowed this bug to mutate, or will I just go, okay, it was their right, I couldn't make them, and now because of their decision, I have to, and the bug continued to exist and changed, I have to now go back and get revaccinated.
Yeah. Well, will the passports stop that?
Well, the assumption is, my argument is the passports would coerce,
Coerce,
would
encourage.
encourage, would strong arm that minority of people to get vaccinated. Maybe not 100% of them, but more of them to get vaccinated.
Yeah,
And
I mean that will work in maybe North Korea or
yeah,
China, communist China. The argument is we're in the United States and can't really coerce folks to.
now you did mention early on, and we all talked about this, the success ratio of some more. This is really awful. This is going to open up a flood of things. I'm not trying to say we should become an authoritarian state, but places like Singapore or Vietnam, where they did have more control over the population, they didn't put up with this. They shut it down. They isolated people, and they did
Very
not have the
true,
infection rates that we did.
very true, and they're not a democracy,
No,
right?
right.
They control their folks, their people, um, and so it's give and take. How much of your rights, your liberty, uh, your freedom, are you willing to give up
For
in,
safety,
in exchange, right?
exactly. That's always been the heart of the issue here. There are certain people. We had this debate when we had the terrorism attacks, and people said we're going to give up certain freedoms. We're going to let the government listen to our phone calls and everything else to find those few bad guys talking about stuff. And some people howled and said, "I don't want the NSA eavesdropping on all my phone calls and
Yeah,
emails." But we basically have kind of rolled over and said, I'll let that if that's how they catch a couple of bad guys.
right.
Howard correctly points out we shouldn't be using North Korea as an inspiration. I kind of 100% agree. I'm not trying to stoke
Right,
people.
Howard. Yeah,
I'm just saying that, and Dan Daly may be 100% right. Once you open the door, it's like a tax. It never goes away. One leads to another. I think that's part of the fear. It isn't.
that's fair.
I suspect that it's the opening the door. It's the slippery slope. Once you allow one thing, does this lead to
Government,
two, three, four,
government
five? Yeah.
overreach,
Yeah.
right? Government overreach, and it depends on who gets elected. If your guy gets elected, you may not,
I mean,
it
not
may not
fear it,
matter.
but yeah.
If the other guy that you don't like gets elected, then he's in control of your life, right?
So last question, and we'll get off of this. All right. So it's clear I'm in the minority in this one. I would feel I like like certain other freedoms we've given up. I might sacrifice. I might let Big Brother track me or force me to do something if it made me, because it would make me feel comfortable. I'd feel everywhere. I could go out in a crowd and not have to worry. It's like I go to my family now. I know everybody's vaccinated. We take our masks off. There's no worry. All right. Having said that, I totally understand what everybody's saying. It is intrusive. It is forceful. It does take us down a certain path that we've been headed for a while, that maybe it's time to draw a line and say no more. You can't make me do anything. I'm tired of government making me do stuff here. Having said that, what about private industry doing it? For example, the university here, UCI.
Yeah, private industry. I mean, we're not gonna, like the universities, the Cal States and the UCs, right? They're mandating masks if you want to go back to school in person. So yeah, they can do it, and they have done it.
And Howard's pushing back at my assertion that the NSA eavesdrops. I mean, that was I don't know. That was the general perception. That's what came out of that. The guy that who was the famous guy that released all this stuff to WikiLeaks and everything here, and that's what he was saying.
Ooh, the guy that's living in Russia right now.
Yeah, that's what they. I mean, that's where I get that information. And Howard say that NSA never did do that. You may be right. He says he has experience with, I guess, FICA courts or whatever, the Federal of Information Act courts. You may be well right, sir. I'm just trying to say that was the general perception. And even when that came out, most people sort of went, if it catches some bad guys, go ahead and listen to my calls.
Well, our calls are listened now by Facebook, YouTube, Instagram.
They know exactly what we're doing. I was at a
we're already giving up our rights. Anytime you talk, your phone is listening to you, and it shows up on a Facebook ad.
Yeah, Alexa. I won't say her name because she'll speak in this room here, but she's always listening to my conversations, waiting for
Alexa's listening to you,
waiting for me to say, "Hey, what's the weather?" or something here.
Yeah, we should go watch The Social Dilemma on Netflix and realize what freedoms we truly have. The truth is you're being listened now, as we are on Facebook, and
by private industry. Yeah, because we're
being commoditized.
Yeah, right.
Right. We're being commoditized.
So in some ways, we've accepted that, and we go, okay, because it gives me something I want. It gives me access to all these free platforms, but they're not free. For the prices, we give them our data, and they sell it to everybody.
They're collecting data. They know where Dan Daly stands on the passport, and Howard, and you and me, right? That data is being collected right now. There is no real.
So having broached the subject and stirred up a hornet's nest, I certainly don't want to dispel. I don't disagree with everything that's been said. I'm just saying, me personally, I wouldn't mind it. I would give up that. I would let that little encroachment happen because it would make me feel safe.
And I know a lot of folks who would love to know that they go to a concert or a restaurant or a business, and they would love to know that everyone around them has been vaccinated.
For example, I'll give you another example. Maybe I'm overstating it here, but years ago they started scanning for weapons at a concert or scanning for weapons at airplanes. And many of us felt, well, that's no good. Hey, I can. In some states now, Texas and others, they're having open carry laws. You can carry a weapon anywhere you want to do. That's part of the fundamental freedoms they feel. But there are places and spaces where they say, you can't bring that in here. And whether you like it or not, whether you want to bring a gun in here, we are going to scan. And the majority of us go, oh, thank God there's no gun in here. Thank God there's no bug in here. Thank God there's no smoke in here. As offensive as that is to some, I think the majority of people, I suspect, would feel a relief.
Yeah, and So again, it boils down to what comforts we are willing to give up.
What freedoms we're willing to give up to feel comfortable.
Freedom, yes. What freedom.
So I'll ask this and I'm trying to stoke a political conversation, but Howard has given us some points, and Dan and some others. Would you be angry if private businesses did this? Would you not support that business? Would you not go to a restaurant that mandated it? Would you not would you not get on an airline that said, you can fly that one all you want, but this airline, that's our differentiator. Everybody here has been vaccinated, and we have proof. We require proof of vaccination to get on this flight, and even though that may lose us some customers, we're banking it'll get us more customers back who will want, like Paul, want to feel safe and when they're on this plane. So, would you feel angry? Yeah,
It's a good question.
fake
Yeah.
passports. That's a whole nother issue, Dan. I
Yeah,
know.
how do you feel about that, Dan or Vivian? Uh,
Would you?
Howard?
So we've established that for many of us, government doing this is an overreach. Would you feel the same if businesses did this? Would you be angry at them and not support them if they said, I don't care what the rest of you are doing. To come in here, you got to have a passport or a proof.
Yeah, well, Dan says at least I have a choice.
Yes, that's
And
true.
so, yes, yes. What's hard is a lot of these students don't necessarily have a choice.
They don't have a choice, right? That's what I'm saying. There are probably not. There will.
Cal State,
There won't
Cal
be
State,
any colleges to go to except those that
it's,
have mandated it.
that's very interesting with that.
Even Howard says it depends. Okay, so there's some room. So there is apparently some room for private business to take action. We're just fearful of government doing it to everybody as a
Yes,
power
yes.
of government.
Because government can take it to the next step, right? Because now you need a passport, not just for this vaccination, but now you need a passport to do this, because we want you to do. Let's say you need a passport for vaccination today. Tomorrow, you may need a passport to be a good citizen passport.
Yeah, right. That's
Right?
not,
To enter a store or a concert or a business, you need good citizen points.
proof that you recycle
Right?
before you can come in here or
Yeah,
something.
yeah, proof that you can, yeah, that you're a recycler, or that you walk grandma across the street or whatever it is, right?
Right.
Did you know in China they have they have this social experiment where they give you extra points for being a good citizen.
No, I never heard of
Yeah,
that. How
it's
do they
happening now.
judge? How do they judge it?
They have specific rules that shows that you're a good citizen if you do this, you do that, and so you get credit for being a good citizen, and that allows you extra privileges and things of that sort. With that,
So Howard makes a good point that the question in a free market is whether we value the good more than than the price.
Sure.
If that's the price of getting in, you have to decide, am I willing to pay the price? And you have a choice. You can go somewhere else. There will be people who say, come on in. You can fly. You can ride. We have a choice whether you're going to smoke or not. It's an interesting debate because society as a whole, when I was a kid, it was no choices. You could drink and drive. So what? I knew people that drank and drive all the time. They had a little, they thought that was funny. They had a little six pack and they would drink as they drove. We quickly decided that was not a good idea. We've decided, rightly or wrongly, that motorcyclists have to wear a helmet because too many of them get injured and then we have to pay for it in emergency rooms. We've decided secondhand smoke is a danger, whether it is or isn't, I don't know. But we've decided as a group we'd rather not we're okay that you can't smoke in a plane or a building anymore
or a restaurant.
or a
Yeah.
restaurant.
Yeah, we take it for granted. I've been out of state and have been to several different states where you can smoke inside restaurants. It's
Like
not
Vegas.
fun.
Yeah, right.
Yeah,
Vegas, baby.
Vegas, right? But yeah, do you know why I'm against drinking and driving?
No.
Because you can spill your drink. I'm just kidding.
That's the biggest reason.
So yeah,
But seriously, I mean, I remember not long ago when I was a teenager, we would drink. I didn't per se, but I had friends that drank and drove. They thought that was funny. They carried a six pack of beer, and you had a beer with you all the time. And so what?
yeah. So I think on the one hand, somebody like me would feel better if I was in a restaurant and I knew everyone was vaccinated. If I was in a plane or a cruise ship and I knew everyone was vaccinated. I mean, personally, I would feel better, right?
Right.
On the other hand, I am also worried about where this can take us next.
Yes, that's the
If I,
overwhelming thing I'm hearing this morning.
where this can take us next.
Right.
What else is government going to mandate besides vaccination? Right, and they can mandate it, right? Once you have your digital, passport, they can add other rules to that passport.
So let me ask you. Here's an example that we're going into a bit of a dark area here, but I'm trying to do it lightly. I've always wondered why we don't just outright ban cigarettes. Why,
or
why,
alcohol.
why do we allow cigarettes to still be, with the overwhelming evidence of what they do? We've put restrictions, we put taxes on them, we've done everything to make it hard to smoke. We've shrunk the number of people who smoke. But again, the theory is if that's what they want to do, it's their choice. Should we allow really bad choice? Is there a limit to the? And I think the answer is clear. We've all decided there are certain limits to every kinds of bad behavior.
Yeah, where does it?
Where does the
That's a
line?
good question. Why don't we ban cigarettes? Is it a freedom and liberty issue, or is it government overreach? You know the the city of Loma Linda does not allow a bar in the city.
Yeah, right. Because
Yeah,
it's a Seventh Day Adventist and whatnot community, and right.
yeah. And so is that government overreach by for a city to ban bars? Is that a government overreach, or is that
In Utah,
I don't know.
bars were severely restricted and have been because of the Mormon faith there. Yes, Dan points out there are certain obvious reasons they don't ban cigarettes because they make a ton of money off of selling cigarettes because they tax the hell out of them. So I guess there's some economic. But I'm just saying, in principle,
Yeah.
are there limits? Do we allow people to do anything as long as it doesn't harm me? It only harms themselves. Or at some point, does government say you can't do that because that's not good for you?
Good question. Well, Deanna says, I would feel better knowing everyone tested negative over being vaccinated.
So she wants a different passport. She just wants one that says you don't have the disease, as opposed
That's just
to
another passport, Deanna. It's called the testing passport. You got to be tested negative.
yeah, right. We could have a double passport here. The
Right?
stronger the argument is limiting. So, all right, no, there's a fascinating thing here. Howard, check this one out. So, Howard has taken a rather libertarian approach in our discussion this morning here, but he says the more government becomes involved in paying for health care, if we, the people, are paying for everybody's health care, if we get to that point where it's Medicare for all, universal health care, then he says there's a stronger argument for limiting bad choices because I'm paying for it. Your bad choice causes you to get sick. I don't care. But if I'm paying for your health care, then I have some say in what you do. That's interesting.
So my question for Howard is this: is Medicare a good thing or a bad thing? Should we eliminate Medicare because Medicare is government funded?
Yeah, it's
And
socialism.
Medi-Cal,
It's straight up social. It,
Medicare is straight up socialism. The VA healthcare is straight up government socialism,
yeah,
right?
right. Social
Should we get rid
security
of,
is socialism.
should
It's the
we get rid
government.
of the VA healthcare, Medicare? That's all government healthcare, is what it is. Uh, so where is the line with that, right?
I,
Where's the line?
when I went to law school, and I did not graduate, but I went to law school at William and Mary in Williamsburg, Virginia, and did well the first year, but just hated it. These sorts of debates went on endlessly. And as my one professor said, he said, you have to realize, my constitutional law professor said, that the American government was set up with a built-in conflict between the rights of the majority and the rights of the minority. And he said it's always going to go back and forth. The minority says, I have the right to do whatever I want. And the majority says, not here, you don't. And so there are all sorts of examples where the majority wins, and there are all sorts of examples where the minority wins. And the example he gave was when Mormons decided they wanted plural marriages, the majority of Americans said, sorry, we don't feel safe with it. We don't like that idea. And so you have a religious right to do what you want, but not in that example. And so we made the Mormon Church, officially at least, change their policy to coexist in America. There have been other examples where the majority has ruled and said, I don't care. That prohibition in the 1920s, you can't drink at all. That didn't last, but lasted for 10 years or whatever it was. So there have been cases where the majority just stomps on the minority's rights and says, I don't care. That's just wrong, and we're not going to allow it. And then, of course, millions of examples, like the ones we're talking about today, where the groups can say, you can't tell me to stop doing this. I can do it if I want to.
Right. Yeah, Howard says, isn't Medicare the biggest cost driver in medical costs? Yes, because Medicare takes care of older seniors, and
Yeah.
older seniors
Get sick.
get sick. Yes. So if you get rid of Medicare for older folks, how would you pay for their health care? Because I can guarantee you that the insurance company is for profit, and they're going to drive up costs a lot more than Medicare will. Uh,
And here's a curious argument. Again, I'm arguing against. Believe me, I can be very libertarian at times. I get this whole idea. I'm not
yeah,
trying to, but I'm just playing the devil's advocate here, and a little bit kind of where I'm coming from.
right.
I understand everybody's fear of government socialism, government in control. There's millions of examples where we say the government doesn't do it better just because they do it in mass bulk. They may not be as nimble. They may not be as cost effective.
Not
Bureaucracies,
efficient, not cost effective,
all
and it
that kind
depends
of
on who's in control.
So all of that I get, but having said this, survey after survey says you ask people who are very conservative, very libertarian, do you want socialism? No, I'll fight it to the death. Great, then do you want to give up Medicare? No, don't touch my Medicare. Are you nuts? Don't touch, how about Social Security? No, don't touch my Social Security. That's good. It is a little bit okay. Are there certain instances where it makes sense? Or is it all bad and we should just go back to everybody, individual responsibility, individual freedom, and the government doesn't watch out for anybody? It sets certain boundaries like speed
Yeah.
limits, but other than that, you can do whatever you want.
Yeah, I mean, who takes care of the, I don't know, the safety net?
Well, and this was a big argument when they had Social Security in the 20s and 30s. I forgot
Right.
exactly when Social Security Act started, but somewhere in the 20s or 30s under Roosevelt. And they argued, they said, so you're going to reward people who didn't save. I saved my whole life, and I'm going to take care of me. And now my neighbor who lived wildly and didn't save a nickel, I'm going to pay for their old age. That seems wrong. You screwed up. It was up to you, buddy, to take care of yourself. Why? And yet, then they said, so what are you going to do? You just going to let them die in the streets? Well, no. But they
Yeah,
should have done something. Yeah, maybe they should have. Maybe they couldn't. Maybe they just didn't make enough, or they had other reasons, or those cases too. But am I responsible when people act badly, when they smoke cigarettes and get sick? Do I have to take care of them, or do I just say, "Hey, that was your choice, buddy"?
it's a good question. Yeah, why not health savings account? I like health savings account. The only issue is you can't rely on your total health care with health saving accounts. If you end up in the hospital for 3 days, Howard, your health saving account is going to be a drop in the bucket for that hospital bill, right? Uh,
And
but
yet, I'm with you on how that, Howard. I don't understand why that didn't take off in the public imagination. I mean, the law was passed, accounts were established, and I don't know anybody that has one, me included. And I don't know why. I don't know why we can't take money out, put it in a tax deferred
because it
thing.
comes out of your paycheck,
I suppose.
and so people are going to say, do I want to take that money and use it for my daily lives, or do I want to set aside some of that money
For a
for a
rainy
health
day fund here.
for a rainy day fund? And most people are like, I want to enjoy that money now. So it's a personal decision. I mean, many corporations offer health savings account. It's just that most people don't use it.
Yeah, no, most people. It was not an idea that caught on in the public imagination, and I'm not sure why. It seemed
I'm a
like
fan. I'm a fan of health saving accounts.
I was too. I thought it was made a lot of sense, but I don't have one, so I wasn't that excited about it.
Yeah, it's because you rather have your money now
Yeah.
than saving for a rainy day fund.
Uh,
And
all right,
but I
so
think health savings accounts are pre-tax, so that's a good thing.
so let's go back to let's get off. I'm sorry. Well, I'm not sorry. I'm fascinated by this. I really am, and I appreciate the honest exchange. I'm not trying to anger anybody or shame
Yeah.
anybody or
Oh yeah.
stoke anything. I understand this is not an easily decided issue. It never has been. That was the point my constitutional professor was making. This has gone on forever, and it will continue. When
Right.
does the rights of the majority outweigh the rights of the minority? That's what it comes down to. If a majority of people want to do something and a minority of people say no, at what point do they have the right to say no, or at what point do we have the right to say sorry? You got to conform. That's just the way it is. So that debate's been going on forever, and it will continue to go on in this. I'm curious though, are we confident that we're coming out of this, or is there a fear? Maybe it's a fear, misperceived fear. What happens if we go backwards again? What if there's a new virulent strain, a new version? It,
I can tell you this is not the last pandemic, guys.
I hate that.
Every few years we're gonna have another bug, right? I think we've learned a lot from this specific bug. I think the whole country learned a lot, and the world. But this is not the last bug. Give it 2-3 years, and some other crazy virus is going to be around. It's just the nature of this world.
And will we be in Asia? I was told, because
Yeah.
they had SARS and some others, they were a little better prepared for it. They reacted a little quicker to it. They didn't drag their feet. They didn't dismiss it. They took quicker action because they'd been through it before. Whereas in this country, we missed that mostly, and we therefore dragged, delayed, deferred, did all these things that let it spread. However you want to describe it, we didn't react quickly, and we didn't react as a complete unit. Everybody didn't say, okay, let's, like if we had a earthquake, everybody would rally together and we'd say, okay, we know what to do. We're prepared. Let's put these plans into place. So my question is this: will the next one be met with more cooperation and more coordination, or will we just be even angrier? Oh, back to this again? No way am I putting a mask on again. Forget it. I don't care how bad it is. No way you're going to get me to shut my business down again. I did that once. Never again.
Great question. Great question. What do you guys think? How will we deal with the next, bug?
If
that
Dr.
comes?
Trin's right and another one's coming next year, next decade, sometime, will this experience teach us something and we'll react quicker and coordinate better, or will it do the opposite and say, I tried that once and I hated it. I'm never going to do that again. I don't care how bad it is. Come up with some other answer. I'm not putting masks on. I'm not shutting my business down ever again for anybody. What do you think?
Yeah, that's a great question, because every few years
I hate that. You say that so casually, and I don't want to believe that. I don't even want to see another one in my lifetime again. However long my life is, I hope this is a once in a blue moon occasion. This is not something I want to go through next year, even or in 5 years. Ever again.
We had the plague, we had the Black Death, we had the smallpox pandemic. These are all viruses. We had cholera. There's many. The Spanish flu. All right, we didn't live through that. We had the H3N2 pandemic. We had the bird flu. HIV was a huge issue, right? We had SARS 2002 to 2004. Guys, this is not the first bug this is not the last bug for sure that's coming our way.
I'm with you, Howard. I don't think governments do plan for the unprecedented very well, and I don't know why. Because if there is, even in a libertarian view of government, that's got the safety of all is always considered one of the powers of government. That it's like we allow for general protection for armies and stuff here. Why can't we have an army of scientists getting ready for the next attack? And why are we always so stunned when it happens?
Yeah, no, I love Mr. Howard and Rotary Club and all that. He's got really great viewpoints and things of that sort. So
and Dan Daly now is going to take a little bit of a different view, and he says, well, I think it's going to be like the flu. We have learned to adapt every year. There's and I tend to agree with Dan. I think I'm agreeing with everybody this morning. I tend to agree that Dan, that if Dr. Trin's right and this bug isn't going to get exterminated, it's going to persist and morph and change, and new ones will follow. It will be like annual flu season. We'll get a cocktail of drugs to fight this bug, that bug, the old bug, the new bug, the flu bug, the foreign bug, the new bug, and we will find. I think this is now part of our new normal. I suspect.
Yeah. Right. Oh, Howard says he's not a true libertarian.
A, a,
Work for the government.
a
Oh
true
no.
a true libertarian is hard to find because you really I think that's one of the problems in the whole libertarian party's had forever is that they keep doing this what if and it gets the smaller and smaller group of so should we allow this? Well, no, you can't. A true libertarian doesn't allow anything. There is no government. It's
I,
everything's gone.
I lean toward libertarianism.
I think a lot of people in this county do.
Yeah, yeah. You know, I
I think
mean,
Californians in general do. That's why we came here.
no, it's like leave me alone.
Right.
Just I'll try to do the right thing.
And yet, sooner or later, we all band together and say, well, maybe everybody shouldn't do that. Maybe you shouldn't drink and drive. Maybe you shouldn't smoke in a restaurant. Maybe you shouldn't. And so we start, I'm a libertarian, but not in this case, you know.
Yeah. Well, I know it's crazy. I think the good news is that we are coming out of the pandemic. Our country is coming out of the pandemic.
Yes.
Um, I think I attribute that to vaccinations because I see the numbers. The higher the vaccination numbers, the lower the hospitalizations. Back in December and January, I was admitting COVID patients left and right in
Yeah.
the ER. Over 50% of our beds in our hospitals were COVID beds, and we saw a lot of folks die. But now the numbers are looking good. When I'm in the ER, I'm not seeing COVID, every other patient. We're still seeing COVID. We're still admitting patients with COVID, but not to the same levels as pre-vaccination.
So I'll leave one last little bomb here. As we look forward to future vaccines, to more vaccines, to fighting more bugs, if this is just the future we're in for a while or forever, should we, as a people, pay, as we did in this case, to get everybody vaccinated, or is it your responsibility to pay for this and get it up? I'm not going to. I don't pay for. I don't pay for other procedures for everybody, but this one's one. It's an emergency. Everybody's got to have it.
Well, I mean, if it's FDA approved, usually the insurers will pay for it. The insurance companies will pay for that.
What percentage of people are uninsured in this country still? Isn't it like 20 or 25%? Still a high number?
Still a high number. I'm not quite sure.
I don't know what the number is. I know it's still a high number. And if that's true, so what happens to them? Do they get free vaccines? Because this vaccine's been pretty much free, right? I mean, I don't know if the government reimburses the insurance companies and the providers for it, but it's...
Yep, it's free. Well, it's not free. Somebody's paying for it.
Yeah.
It's just that we are not paying for it. It's paid for by the federal government. In a way, we are paying for it through our taxes that funds the government, right?
Right.
But it's not coming out of our personal pockets. But yeah, it's a good question.
And last, I'll leave you one more here. Maybe this is for a future episode. So when we get the all clear, when the signal's out, if Governor Newsom does what he's saying he's going to do in this state, he's going to scrap the whole system come June. We don't need it anymore. Yep. We're back to normal, all clear. Will we take this mask and throw it in the trash immediately? Or will we continue to say, I don't know, I may wear it. I know I don't have to. I know I'm not mandated to. I know you say it's all clear, but I'm going to keep wearing it for a while. Like they did in China and other places where they just became normal. They wore the mask whether or not they had to. They just felt better wearing it.
For pollution purposes too.
That too, yeah.
Right. But that's a good point because there are a lot of folks who may or may not realize that the CDC has dropped the public mask recommendation.
Yeah, right? As of this week, I think, yeah.
If you are vaccinated, you're out in public, you're not around a whole bunch of folks, unmask, right?
I personally,
a lot of people
I'm going to ask Dr. Trin this and then we'll go. I personally am going to keep wearing my mask for a while. Whether they have to or not, whether they say it's safe or not, I'm going to be like, until I'm really sure, I may wear a mask for another 6 months, particularly in groups at a restaurant, at a bar, or airplane.
Okay, this is why we live in America. If you want to wear a mask, wear a mask.
But will I be shamed for wearing a mask? Oh, you silly old man here, just come on, knock it off. It's safe. Take it off.
I hope not. I hope not. That's.
What about you, Dr. Trin? You going to keep wearing it, or are you going to can't wait to take it off and throw it away?
when I'm out hiking in the woods, why the heck would I wear a mask if there's nobody around me?
Right.
And even through the pandemic, when I went hiking, and there's nobody around me, there's no science that tells me I should be wearing a mask.
Right.
If I'm in, of course, if I'm in a group of folks, I'll put a mask on.
Even when it's safe, even when they say, Dr. Trin, it's all clear.
Yeah, I'm not. I just follow the science.
You know why I'm going to do it? Because the same reason everybody brought up this morning. I don't trust the government and the experts. Just because you say it's all clear, I wasn't sure I should wear one in the first place, and you got me to wear it. Now I'm not sure I'm going to take it off just because you say it's okay.
You're absolutely right. People don't trust the government in one way or the other.
Exactly.
So either way, yeah, there's distrust of the government.
All right. Good show. Thanks for the conversation. Thanks for the honest exchange. That's what's missing too much in America here. We can disagree and still like each other, and we can disagree honestly and openly here, and debate and discuss, because that's where we're all trying to figure out what is the future of health in this country here.
Right.
All right. Thanks.
Great talk.
All right. Well, there you have it. If you want to hear both sides of the issue, if you want to hear what everybody's thinking about health and try and compare it to what experts like Dr. Trin, who's always evaluating this stuff, and give you their point of view, then check in with us. Join us. We're here every Thursday for Health Talks with Dr. Trin.